This YouTube story related on video based on the racial discrimination committed by the then Clinical Commissioning Group, now the Integrated Care Board, related on the decision support tool assessment continue healthcare since July the 27th, 2021, and in reference to the Parliamentary and Health Service Ombudsman dated May the 12th, 2022 and May the 16th, 2022. However, Sue Cooper, the independent nurse assessor, breached the Equality Act 2010 and Section 6, Section 9, Section 20, and Section 149. Miss Cooper abused the service user right on the ground of its multidisability and race, breached the Autism Act 2009, Section 3, the Equality Act related to race under Section 9, the Equality Act related to disability, Section 6, Section 20, and Section 149, the United Nations Convention on the Right of Persons with Disability. This includes the United Nations Convention on the Right of Older Person, and she breached the United Nations Convention and all form against racial discrimination, inadvertently failed to follow the regulatory process of the PHSO, that means the Parliamentary and Health Service Ombudsman, contravene the NHS anti-corruption policy under the Bribery Act and the United Nations Convention against corruption. In this respect, Sue Cooper already been exposed for racism and corruption, which she abused the service user right on the ground of its disability and race. This includes racial discrimination, as a very serious matter on May the 12th, 2022 and May the 16th, 2022. Sue Cooper, the independent assessor nurse, refused to accept the 12-page appeal letter of March the 18th, 2022 from a support practitioner of a vice resolution have committed institutionalized abuse, bribery, corruption, racial discrimination under the Equality Act. She has committed corruption under the Bribery Act that carry imprisonment sentence up to 10 years, breaches the United Nations Convention against Corruption. Sue Cooper has committed abuses on the ground of the service user disability and race, is defended the corruption of Nurse Catherine Hannon on the DST assessment dated July the 27th, 2021. A serious allegation against Ms. Cooper has been exposed for racial discrimination, and she has breached the Equality Act under Section 6, 9, 20, and 149 on May the 12th and May the 16th, because she has committed racial discrimination in this regard. Sue Cooper made a telephone call out of the blue, failed to follow procedure, acted with racial discrimination as a very serious allegation against her that she has committed discrimination, bribery, and corruption on May the 12th. Sue Cooper acted with deceit. This includes racial discrimination, trying to enforce a local resolution meeting by treating the service user with extreme disrespect on the ground of his race and disability, using white privilege, abused her position, committed abuse, bribery, corruption, and discrimination. Ms. Cooper, in her attempt to impose a local resolution meeting is a waste of time, which she abused the service user rights on the ground of his disability, breached the Equality Act Section 6, 20 and 149, and she breached the United Nations Convention on the Right of Persons with Disability. Ms. Cooper, in her role, refused to accept the 12-page appeal letter of March the 18th, 2022, but to shut down the appeal process. But Ms. Cooper is defending the corruption practices and racial discrimination practices of her colleague Nurse Catherine Hannon on the decision support tool on July the 27th, 2021. Ms. Cooper attempt to cover up the telephone call to the support practitioner, committed corruption under the Bribery Act, failed to follow procedures, has committed these offences under the Bribery Act on May the 12th, 2022, that carry an imprisonment term up to 10 years. In this regard, in other words, the CCG and now called the Integrated Care Board had commissioned Ms. Cooper as an independent nurse assessor to maintain white privilege and cover up the corruption and discrimination in the process. Ms. Cooper would be happy to commit abuse, bribery, corruption, and discrimination on the grand scale by offering the client, service user, and the support practitioner some form of a bribe by defending the corruption of Nurse Catherine Hannon. In this regard, Ms. Cooper attempt to suppress the 12-page appeal evidence letter of March the 18th, did not follow procedures, abused the process, abused her position by using white privilege under the Fraud Act 2006. This include abusing her position. This include abusing her position of trust and responsibilities. This include corruption and bribery. And this include racial discrimination in this regard.